The Treatment Action Campaign says lack of awareness about HIV prevention measures, shame around sex, and condom shortages are among key contributors to high infection rates. A report by the South African National AIDS Council reveals that about 1,300 people aged between 15 to 24 years are infected with HIV every week nationally. For more on this topic, we are now joined by the Treatment Action Campaign chairperson, Sibongile Tshabalala. Tshabalala, thank you so much for joining us this evening. Now, there was once a time when HIV and AIDS was top of mind for many South Africans, many of us reciting the ABCs and the constant testing amongst individuals as well as couples. Where would you say we set the foot off the accelerator when it came to HIV awareness?
Thank you, Katleo, for having me, and greetings to the viewers. As a country, I think we have missed it a long time ago, especially on issues of prevention of HIV. As soon as we started to roll out ARVs, we forgot that there are also people who will be infected. And the scale of HIV awareness has been reduced, or it has not been like the earlier days. Remember, in the earlier days, you will see every corner, every minute in a television or in a radio, there was something about HIV, people talking about HIV. But now we no longer see that happening, and hence we are where we are today, but also the political will in terms of meeting the 95 targets and ending AIDS by 2030 is just something that we only talk, our government or our leaders only talk about them, but in terms of implementation, it's something that is totally different. As we are talking now, we have a huge shortage of condoms, and this shortage of condoms, it's not something that has been started last week or a week before last, but it's been months without condoms, and nobody is talking about that. We have introduced PrEP as a preventative tool, but the question is how many young people who understand what is PrEP, the awareness or the education about PrEP has been there. When we do our monitoring, stop-stock-out monitoring and through retreats and monitoring, we found out that most of young people, they don't know anything about PrEP. PrEP, intake, it's not up to the standard. Hence, we see so much being infected with. And it's that after all that we have done as a country, as activists, trying to fight HIV, but we still see this high rate of infection, especially from young people. That means the young people that we prevented in the early 90s, that we were taking, advocating for PMTCT, which is prevention of mother to child. Today, those children are infected with HIV. So all the work that we have done trying to save our babies, prevent them from being infected with HIV, but today they are exposed to HIV because of our services that are not there in the country.
I want us to further unpack the issue of PrEP and condoms a little later. But on the issue of some of the social ills that we are facing with regards to how many of these young people are now being infected by HIV and AIDS, like you're saying, we were able to prevent them from attaining HIV and AIDS from their mothers. But it seems as though there's also a stigma issue with young people going into health facilities looking for things such as condoms, but they're met up with the stigmatization of them being sexually active. What do you think still contributes to such, knowing that young people would rather have condoms to use in order to protect themselves from HIV and AIDS than being met by that stigma from health facilities?
Yeah, if you look at our system, Katleho, it's not welcoming to young people. The settings of our clinics, accommodative to old people, and most of the people who are using healthcare centers are old people. So when young people are in the facility, they are discriminated, or they are they are judged by starting by the healthcare workers. We had so many stories of young people when they go to the facility just to ask for contraceptives. They'll be telling them, preaching to them to say, why are you taking contraceptives? It means you are sleeping around. You know, you don't, your behavior, it's very bad. So when you expect a young person to go in a clinic full of adults and expect that young person to go and take condoms, then that is something else that we wouldn't think that young people will do, even if I wasn't going to be able to do that because of an embarrassment, and everyone will see that I'm sexually active because I'm taking condoms. But also looking at the issue of social ills and discrimination, we know that PrEP is also ARVs, and for us to have more people today who are initiated on ARVs, it was because of treatment education to people, so people understand why they have to take medication because they're HIV. But now, when you look at the education to PrEP to young people, that is no longer there. So young people, they don't know these pills, they don't know how to take them, and sometimes because of stigma, when they go out to their boyfriends or wherever, they are scared to take them because people will perceive that they are HIV positive. So those are the things. So we are advocating for youth-friendly facilities where young people, they'll be able to go in and will see a young nurse or a young doctor who will be able to take to talk to a young person and give services as they need. But for now, they are scared because they are mothers in the clinic. They have to talk to people who are very old to them, grannies or mothers, and it's difficult because before they are getting the services, or sometimes they go out of the facility without even getting those services because of the nature of our healthcare system.
Right. And those statistics are quite alarming, Mam Sibongile. I mean, 1,300 young people between the ages of 15 and 24 are infected with HIV and AIDS weekly. Just for us to unpack this number, are these transmissions happening amongst peers? What are other social factors that are at play here that are contributing to these numbers?
We know that we are living in a country where some social ills are very bad, and we know that there are issues of sugar daddies who are blessers, who continue to exploit young people and sleep with them and infect them with HIV. And while we are talking about that, we know that the uptake of the ARVs, especially to men, it's very low. So what does that mean? It means there are a lot of men who are old men who are infecting these young people with HIV. But also the other issue is gender-based violence, that we only talk about it when there are those months of Women's Month, and when something happened to say, yeah, young people are exposed to gender-based violence. Gender-based violence is still one of the contributing factors that makes young people to be HIV positive. If you can remember, just few days, we were talking about children with who are pregnant. I refuse to say teenagers, because if you are saying a 10-year-old is a teenager, we are lying to ourselves. A 10-year-old, if that 10-year-old can be pregnant, who impregnated that child? It means there is type of gender-based violence that is happening in the house, at school, and in the community. That we are just talking about it, but not doing much about it. So those, I think, are the more causes of infection, high infection rate, especially to young people. And also remember, young people are are living the life that is it's above their economical status and the peer pressure and all those things. So these old men are still taking advantage of our young people, and that is very sad because there is not much that is happening in the country in terms of addressing those issues.
It certainly is very sad. Ma'am Sibongile, earlier on you mentioned the issue of PrEP as well as young people not having enough knowledge around what PrEP is, what its functions are. But I also know that the TAC is advocating for the injectables as opposed to the oral PrEP that currently is on the market. What is government doing in that relation in terms of educating young people in terms of what PrEP is, and how far along are we in terms of moving to getting the injectables as opposed to the oral PrEP?
Honestly, in terms of government doing, in terms of educating young people on issues of PrEP, there's not much that the government is doing. Only civil society that is out there trying to teach young people about PrEP, and up to a point where when you do facility monitoring in one of the facilities, we ask about PrEP, and the nurse, the healthcare worker didn't know what is PrEP until another counselor said, no, a PrEP are those pills that we give to people who are HIV negative, and that's when she knew what is PrEP. So if government officials and people who are working for government, they don't understand PrEP, then it means there is a lot that is not happening right within the system that we have. But now we are talking about injectable PrEP. That is what we are advocating. Why we are advocating for injectable PrEP? It's because it will reduce stigma, and it will also lessen the burden of taking pills every day, especially for young people. And we think that if it's injectable and we continue to educate young people, there will be more young people taking injectable other than oral pill. But in terms of a scale that it's coming with, it's in a very snail pace. You only hear about it when the minister talks to the issues of HIV, but we are not yet sure to say how far is it with the registration with SAFRA, when is it going to be available in our public healthcare sector so that we can be able to access it, or young people be able to access it. So it means we need to continue to advocate and make noise for young people. Hence, we continue to do programs with young people so that young people can understand what are the issues, and at some point we need young people to take up these issues and advocate for themselves, because they are the ones who are mostly affected by these issues.
Most certainly. And I mean, speaking about these issues and the minister as well, we know that we currently have the 95-95-95 policy, where there's a policy or a target around 95% of people living with HIV and AIDS knowing their status, 95% of those then taking treatment, as well as then 95 of those that are taking treatment to have their viral load suppression by 2025. Are these targets realistic?
Honestly, the targets, yes, are there. And when you look at how we are as a country, we are not doing very well. Yes, in terms of the first 95, we are doing very well in terms of testing, but the second and the third 95, we are not doing very well. What does that mean? It means we test more people and we are unable to link people to care, which is a problem, because the very same people that we are testing and are testing positive and are not linked to care are the ones who are mostly infecting other people with HIV. So I think when, as a country, we need to do more, and when we need to talk about ending AIDS, we need all stakeholders to be part the fight of HIV, but also we need the same energy that we saw when we had COVID at rise in the country in terms of fighting HIV. And by doing that, I believe that we will meet all these targets, 95, 95, 95. But without political will and all the energy that the government showed when there was COVID, then we cannot. And it shows that our government, it's not like they can't put energies in fighting diseases or infections like HIV and others. If they were able to do it with COVID, then it means they can do it with TB. They can also do it with HIV infection and preventing more young people to be infected with HIV.
All right. Thank you so much for your time this evening. That was Treatment Action Campaign Chairperson Sibongile Tshabalala speaking to us there about the lack of HIV awareness that we currently have in the country and those alarming rates of young people being infected on a weekly basis.